In the United States, racial and ethnic minorities have historically faced disparities in access to healthcare and the quality of care they receive. While laws like the Affordable Care Act have helped improve these differences, some minority groups still experience higher rates of illness and death from various health conditions compared to white people. They also continue to encounter prejudice and barriers to health care. These disparities also extend to the treatment of plaque psoriasis, a skin disease that causes an itchy, scaly rash. Research has shown that racial minorities are less likely to see a doctor for this condition compared to white people. In this video, we will explore the reasons for these disparities and discuss how the medical community can work to address them. The problem of insurance can make it difficult for people of color to access the care they need for their psoriasis. In the United States, racial and ethnic minorities are more likely to be uninsured, with Hispanics, American Indians, and Alaska Natives being over 2.5 times more likely to have no coverage. Black Americans also have almost double the uninsured rate compared to whites. Once you are able to see a doctor, getting a proper diagnosis for psoriasis can be challenging, especially for people of color. This is because many doctors are not trained to recognize psoriasis on non-white skin. The condition may look different on darker skin tones, making it harder to diagnose. A biopsy, which involves studying a small skin sample under a microscope, can help doctors confirm the presence of psoriasis. Access to treatment can also be a barrier for people of color, as there may be a lack of dermatologists in underserved communities. Additionally, finding a dermatologist of the same race or ethnicity can be challenging, even though dermatologists of all backgrounds are qualified to treat skin of color. Research also shows that black people with psoriasis are less likely to receive certain treatments, such as biologics, due to insurance coverage or other barriers. Medical training and research need to become more inclusive to help doctors better diagnose and treat people of color. Efforts are being made to include a broader range of skin tones in educational courses, textbooks, and other resources. It's important for students to learn to diagnose skin diseases face-to-face with people from different racial and ethnic backgrounds. This exposure can help doctors better understand how to treat a diverse range of patients. There is also a lack of diversity in psoriasis research, as treatments have mainly been studied in white people with the condition. However, there is a growing recognition of the need for more racial diversity in clinical trials. Researchers are making an effort to include a wider range of people in dermatology studies to better understand how treatments affect different groups. It's also crucial for doctors to listen to their patients of color during diagnosis and treatment. Patients should be given the opportunity to express their experiences, concerns, and preferences when it comes to their psoriasis care. This open communication can lead to better treatment outcomes for people of color.